Well, good afternoon, everyone, online and in person. Welcome to our second session of the Summer Brown Bag series. And we're honored to have you all here with us for this panel that's going to blow you away today. A few housekeeping items. I believe I'm supposed to let you know to use the Q&A and not the chat when it comes time for questions. So as a reminder, use the Q&A and not the chat. Those in the room, you'll just raise your hand and you'll be called upon. I'm also supposed to remind you of, yes, this is our second session. We have a session next week. We're taking the following week off, and then we have the first 3 weeks of August. So for those that may forget, please visit us online and we'll have all types of information for you. I'll remind you of that piece again at the end of the session today. So what I'd like to do now is introduce the person who'll be moderating this panel. And I say introduce her. I will really just briefly introduce her and let her do a little bit more of an introduction about herself, and then she'll get into the panel with you all. This is the first time that we've done something like this, so we hope that you're able to follow along. If you have any issues, those of you that are online, feel free to just let us know in the Q&A section. So I'd like to introduce you to Arielle Sheftall, PhD. She is an associate professor here in the Department of Psychiatry, the University of Rochester. She is going to be leading this panel today, and she put together this fantastic group. We have folks that are in person as well as online. And so I'd like to bring up Arielle and let her take it away. Welcome.
Thank you all for being here, coming on in. I appreciate that. And thank you all to our online audience as well. Today, what we're going to be talking about is suicidal thoughts and behaviors from different perspectives. And the reason why I wanted to bring together different professions is I think in psychiatry, we hear the clinical, right? We hear the research side, but we forget sometimes that there's other people within our field that are actually doing this work and are doing it from different sides of the story. So today we're actually going to be hearing from those folks. So I'm going to be asking them questions to share about their experiences. And then also I'm going to have you guys have the opportunity to ask questions as well. So first and foremost, let me do the intros, get those out the way. So online with us, we have Dr. Danielle Harrell. She's an assistant professor at the University of Texas at Arlington. She is a full-fledged social worker, but her research interests are actually looking at social connectedness. So how does social connectedness relate to suicidal behavior and thoughts in children? She is also interested in adaptation of interventions for younger children, so starting as young as kindergarten all the way up to 12th grade. So as you can see, she has a lot going on, but she has been very graciously will be joining us via, thank goodness for Zoom. Woo! All right. And then we have Dr. Donte Boyd. Dr. Donte Boyd is also a social worker, but is an associate professor at the Ohio State University. So we have to say Z, it's like a thing. He's in the College of Social Work, and he's joining us here live. And he is a researcher, but also a clinician, and actually looks at suicidal behavior and looks at interventions from a strength-based perspective. So a lot of what we do in the field is looking at risks. Well, he actually looks at it from strengths. How can we actually engage youth, engage families and others to actually strengthen their well-being versus what is that risk that's going to cause that behavior to occur? So that is Donte. We also have the lovely Ms. Patrice Robinson, who is the CEO and co-founder of the Landon Robinson Foundation. So a different perspective, right? She actually has tons of degrees, which she graduated from the University of Memphis with a bachelor's in biology and chemistry. Then she went to get her master's at Ohio Dominican University in science management and business administration. She is the proud mother of Landon Robinson, who was actually drafted by the Cincinnati Bengals in 2006. And Landon, and she'll tell you all about Landon, but Landon is also an advocate, a strong advocate for youth mental health and suicidal behavior. And I have known him since he was a very little person. And I have just loved and grown with the Landon Foundation. I'm proud to be a part of the foundation, but she can talk to you guys about that perspective and how the foundation looks at youth suicide and mental health and what their plans are in the future. And then also we have Dr. Well, I call him Doctor, but on Brandon Johnson. I call him Doctor, but Brandon Johnson. Brandon was born and raised in Baltimore, but we won't pick that against him. Has worked in the suicide field for 13 years. He and I came together and worked on one of the initiatives that is very near and dear to my heart, Black Youth Suicide. So he actually has done amazing work with actually kicking off state initiatives to actually get folks involved with preventing Black youth suicide, educating people about Black youth suicide. And there is a book back there on the table if you guys are interested in grabbing one of those. But he is one of the best. So I'm grateful that he's here. And I look forward to you guys asking him questions and also me asking questions as well. And then last but not least, our native. So Ms. Alia Henton-Williams is here with us. She is I call her the director, the manager, and the director of the Crisis Intervention Services here in the city of Rochester. So basically what happens is if God forbid there is a homicide or a suicide that happens, she manages a team to actually go out and be with that family, be with the folks that are unfortunately suffering from that loss. So she has a lot going on, and she unfortunately is working on the Danielle pilot right now, so was unable to join us last night for a good time, but that's all right because she is where she needs to be, and that's what we want. She's doing the hard work to make sure that we as a city are thriving. So those are our folks that are on the panel, and I will first and foremost stop sharing so that we can do that. Oh yeah, I got this. Okay. All right, perfect. So, ready? You guys ready? Yeah, the hard stuff. So Danielle, I'm gonna start with you if that's okay.
Okay.
So, why is suicide and suicidal behaviors a topic that you have investigated?
That's a great question. And so for me, it didn't come overnight. My background, I was a former school social worker, a clinician in the field, working with children who were also affected by the child welfare system. And so along that journey, as I was doing my field work, I continued to encounter families that struggle with mental health, particularly suicide specifically, and then also within the education system. I found a lot of the work that I did, the bigger issue. I was focused a lot on academic achievement, their connections within the school environment, but realizing that there was a growing area and need for suicide prevention research within the school setting. And so it was along that journey where I decided to go back and further my education and study and do more work, and become a researcher and focus on the issues. What I was seeing was that a lot of kids of color, was in a urban area in Louisiana, a lot of kids of color, instead of being referred to access to care for the mental health symptomology that they were presenting with, they were being transported down the disciplinary pipeline. And so they weren't actually getting the services that they need. Individuals just misunderstood the things that they were going through. So I think it was just a collection of these things, a collection of these events, encountering students who were cutting themselves, encountering all these different things that were characteristics of suicidal behaviors, and rarely anyone in the school setting wanting to talk about it or wanting to actually intervene. And so it was along that journey that I decided to pursue my research and delve deeper into Black youth suicide prevention. And so along the way, I applied for a training grant to get more research training, because my background is in school social work, and like I said, I focused on education factors, and also have a minor in educational research. And so looking at the actual system of the school and how that affects the well-being of students. And so although I do have the contextual understanding of the school environment and what that looks like and how that could have a positive or negative influence on a child's trajectory, I was missing the piece of actual suicide prevention, suicide research. And so I applied for the training grant. And luckily, I was able to connect with Arielle, Dr. Sheftall. And so she has been, over the course of, I'll say 2-3 years, it's been a while now, have been training me in suicide prevention research, particularly with younger kids. So I would do a lot of work with elementary age youth. And so that's kind of how I came to it. It wasn't like a linear trajectory. It was kind of along the way I realized there was a greater need, and then there was a person that needed to take action. And so I just answered that call.
Well, thank you. Thank you so much for answering that question. I'm gonna turn it over to our esteemed panel. Brandon, tell me, why suicide? Why suicidal behavior?
So I think for me, it really kind of started understanding and really seeing how like mental health was really not something we talked about in our community, and not something that we shared about really, particularly growing up in Baltimore. And I grew up in inner city Baltimore. Go Ravens! I know I'm amongst Bills fans. I know I'm suffering through it. We're gonna get through it. But as a part of that, it was one of the things that like it was impacting all of us in a certain way. Trauma, exposure to violence, all those kind of pieces that are there. It was there, it was present, but we weren't talking about it. Nobody was really engaged with it about, how it was impacting us. And it was kind of like normal, right? Like we all go through it, we all get through it, and we all pretend like we're getting through it well, but we're not. And so I think as I went to Morgan State University and did a lot of my work on the mental health effects of like community violence, right, interpersonal violence, and I went and got my master's at Hopkins and was doing the same thing. And I was privileged enough to take a position at the state of Maryland to be director of youth violence prevention and suicide prevention. And as a part of it, I'm like, as we were going through, they're like, yeah, it's pretty split, the position's pretty split. It was not. So when I got there, it was about 85% suicide prevention and this little carve out for youth violence prevention. And as I grew with the position and really got to see how it was impacting different groups in different ways, and people talked about it differently, like it showed up differently, the conversations were different. I really wanted to be a part of changing that conversation and improving that, especially as we talk about our young people. And being at the state, you're constantly in community, you're talking to families, people who are impacted, and it just drove me to be like, I want to be a part of figuring this thing out. And thankfully, it's just led me to, again, being a part of my career for about the last 13 years. But it started in community and exposure to these mental health challenges in community.
Thank you so much, for both of you answering that question. So Donte, if you don't mind, from your professional perspective, what is the most urgent challenge in preventing suicide and suicidal behavior right now?
I think a combination of things. When you think about, so I lived in like 4 or 5 different cities, from St. Louis, Columbus, now Detroit, and from Los Angeles. The Midwest loves me. I think one, how we define suicide. and how people think about it, right? And how research is done around suicide. Traditionally, suicide was a white thing, right? It was a white man thing. That's how they do research when thinking about it today in clinic settings. But when coming from starting my career doing sexual health and HIV prevention, which is so far along in terms of thinking about prevention, because the resources was there, but also the advocacy was there. In the last 4 years in transitioning and looking more at suicide prevention among young men, the advocacy is not there, and the research in the community context is not there. So when people are reporting and you see these numbers or these decreases, a lot of these samples are small. They're done only in clinics. And so you're missing a whole lot of people that in our studies that even we're conducting now, ideation is reporting about 35–40%. We're seeing these reports come out of these newspapers and all these other things with the 30–40%. But then when you look at these old federal government things and they're like 2%, like one, we already do a bad job in collecting data in this country. And so in suicide prevention, it's one, how do we define it for the average person? How do we get them involved as opposed to trying to do that on the back end? And then doing larger studies outside of the hospital and clinic context and bringing the science to it.
Thank you. Thank you for answering that. Ms. Alia, I have a question for you, if you don't mind.
Certainly.
So how can schools, health systems, community organizations strengthen their crisis response and post-vention plans? I know that's a big question.
I'm going to try my best.
Yes.
So speaking from really a first responder, direct service in the field perspective, for us, it's always about awareness. We're a 24/7 unit that's consistently responding to the community around all types of crises. And so one of the key things for us is always being ready, always being prepared. And so with that, that means that we have to pay attention to what's happening around us. It's important for us because I think that over the past 5 years since we started the Person in Crisis team in particular, what's been so profound for us is something that you were just talking about in terms of how suicide looks so different now. And so I know that even for me personally, it's not what I thought it was. And so we had to come to that awareness really quickly in order to better prepare ourselves for how to engage in the community, how to support, how to be there for community members, family members, law enforcement. And so it's important for our schools to not only be aware, to be prepared, but to also be listening and be paying attention. What is it that our students and family are bringing to us and saying to us, and to put aside what we've been most familiar with, which is for people of color, and that this does not affect us, that this is not a part of our community, and especially not for our young people. So that awareness is definitely important, creating those plans around how do we address and support and provide services for those young people who we know are at risk. That might mean going beyond the young person. You're going to have to go into the home, you're going to have to go into the community, and we're going to have to amp it up. What we're doing now is just simply not enough. In 2025, I know that we responded to over 200 calls that were connected to suicides, and they were across the lifespan. And so again, eye-opening. And so those are the messages that our schools have to hear, that it is happening, it is a thing, and that we are responsible for responding to it appropriately.
And what do you think about post-vention? I have heard horror stories about post-vention, specifically, unfortunately, in the state of Ohio. Tell me a little bit about post-vention. What does that even mean? Tell the audience if you don't mind.
So from our perspective, again, it's around what's going to happen after something occurs. What does that response look like? And it has to be intentional, it has to be focused. Our community has many resources. but where's the impact and the outcome? And that goes to speak to the postvention not being adequate. It's not where it should be. I don't think that oftentimes, especially with young people, and even with us responding to crisis, we're there to eliminate the immediate crisis, but you have to go into the long term. And so I think that that's often the missing piece. And so again, there is a responsibility to making sure that that plan is appropriate, that is robust, that it is meeting the specific needs of individuals.
No, I appreciate it. Thank you. So Patrice, I have a question for you. How does your foundation decide which suicide prevention initiatives they're actually going to support or even initiate?
Okay, well, first of all, I want to say thank you. Thank you for having me here. Thank you for inviting me to be a part of this panel. I feel very blessed and very honored to be amongst all of you guys, the experts. You know, I consider you the experts, and your work is, number one, invaluable. If no one has ever said thank you, if no one has ever said we appreciate the work that you do, the lessons that you are learning as a student body, I want to say thank you. It is appreciated, and I am just a sponge right now, learning, truly learning and taking all of this in. So thank you, Chanel. Thank you, Dr. Sheftall, for having me a part of this panel. My organization is brand new, right? We became a 501(c) in May of 2026, you know, the day after my son graduated from the United States Naval Academy and was also drafted by the Cincinnati Bengals, now class of 2026. So everybody's gonna be a Bengal fan. I appreciate that. But the question was
Yeah, how does your foundation think about,
okay.
what do you think about when you think about supporting certain efforts that surround suicide prevention?
Okay.
Or even like programs that you guys are going to be engaging?
Right, right. I just wanted to I wanted to hear that again, so I made sure I answered it exactly the way you need me to. With the opening of the foundation, one of the things that impacted me as a mom
Yes.
was seeing the impact of suicide attempts in my son's school. So my son had friends who committed suicide, and an astronomical amount in a very, very short amount of time. There were 5 suicides in a matter of 4 years or something like that. And there was one in particular that like reached me to my core. And what I realized at that moment was that there were no resources available in the area that we live in. And that when this attempt when it happened, no one talked about it. The family didn't talk about it. The family didn't talk about it. There were no resources around it, and it impacted my son, right? And so there were counselors that talked about it for maybe a day and a half, and then, you know, it was back to business as usual. But it didn't go back to business as usual for my son. It really impacted him. And so at that moment, I was just a mom, you know, and I felt exasperated. I felt like I don't have a voice. What do I say? You know, how do I impact this? How do I change this? And I made a promise to my son. We made many promises along the way of this journey of him being drafted to the NFL. It's like, if this happens for you and God blesses you to make this happen, for your dream to come true, that platform will be used for more than just the sports aspect of it. It's a larger platform, and it's a platform where now I'm not just a mom. You know, I'm a mom now that the world and society sees as a mom of an NFL player. So there's this level of acknowledgement or notoriety, if you will, that now I can speak and maybe have some impact. And so how we identify organizations or families or events that we want to help within the community is I want to be a part of that grassroots efforts of, we have the resources. As she said earlier, the resources are there, but how do we get those resources into the community? How do we help? How do we change? And be involved. And so that's the way I think that we are going to move forward, is at the level of the NFL, resources are really not an issue at that point. It's really boots on the ground. It's really, how do we organize, our team to go into the community and help our Black and brown boys and girls, or any race, and so that's what I want to do, and that's how I want to impact. And those are the organizations that I want to impact, is those who are actually going in and doing the work.
Thank you. Thank you for answering that. I appreciate it. All right. So Danielle, coming back to you. What can be done to shorten the time between research findings and its use in real life settings?
That's a great question. And I think for me, when I think about research findings and then it being triangulated into additional settings, I think we have to stop thinking about dissemination as the final step. A lot of times when we do work, we collect data, we run analyses, and we publish the work, it stops there. And so getting into the habit of going beyond that step, right? I do a lot of work with school settings. And so I'm thinking about within the context of that. Now my team, we create what we call just short reports or white pages or things like that. And these are very just a flyer with a snapshot of a finding that we circulate through the school environment. So that way teachers and administrators and even circulating into the families where they have a general understanding of research. And so one thing in particular that I'm thinking of, and it's been recent, we've had, so I'm a research consultant with a large charter school here in Dallas, Texas. And we had an incident where a family member came to the school and they were upset that the child received a screening, a screening assessment. And the school clinicians went through the proper channels, and so the child was referred, and the child presented with some ideations, and they did the assessment as they do, and then they contacted the parent thereafter. And so there was a frustration with the parent of, you contacted me after, you've put this thought into my child's head. They would have never, and this is thinking about elementary campuses, so that's what I work with a lot. And so this idea of that, a misconception that if we talk directly to children or younger children about suicidal thoughts and behaviors, that we are invoking this thought in their mind, or we are introducing something into their mind. And so we pulled some research and some studies, and we pulled out just a short statement just indicating that this has been debunked, that actually research encourages screening of younger kids, so that way we can help connect them to resources faster, sooner. And so things like that in terms of getting our research out. Another avenue that I think of, because we're struggling with in terms of the policy landscape, and then I enjoy hearing from you all, but we are falling flat on, and I'm also in Texas, and so there's a lot going on with the political landscape. They feel we are indoctrinating their children when we talk about mental health in the school environment. So there's a lot of challenges that we must overcome before we can even get the step of dissemination and getting our work out. But trying to figure out how to sit at the table with policymakers, influential individuals, and speak to them about the work that we do, and this idea of thinking about suicide prevention as a public health initiative, right? When we think about how we treat heart disease or how we prevent heart disease and cancer, we want to do the same thing for suicide prevention and suicide research. And so it's about having these difficult conversations, being able to be at these tables. And unfortunately, not everyone is in these rooms, or the rooms is not reflective or representative of the community or the community body of individuals that actually need the services or the help or the support. And so galvanizing those efforts to be in those rooms, putting ourselves out there just to say, hey, we want to have conversations. We want to share with you about the work that we're doing. We want you to understand how we are working with the school district for the interest of the kids, for the interest of the families. And then that final step, obviously, to drive academic achievement, because that is the focus of the school environment, despite how many resources they have in there, whether it be mental health, a school school-based mental health center and all these things, the end goal for schools in this season, I'll say that because I am hopeful that it is changing, but in this season, it is about academic achievement. So a lot of times I have to do the bargaining of I'm focused on suicide prevention, but I'm also focused on math achievement as well, just to be able to get into the school setting to do the work that I need to do. And working with clinicians right now, I forget one of you said something that was very important. I think, Alia, when you're talking about the post-vention, some of the clinicians are fearful to have these conversations with the kids for this very reason that I indicated earlier about if I say this, I'm going to put a thought in their head and then they're going to go home to their family and parents and indicate this. And so it is a community level initiative that needs to take place in terms of taking the research, dissecting it and making it adjustable for people to see. They're not reading our articles. They're not reading our LinkedIn posts. They're not reading these things, but how can we make subsets of this information digestible for families and for communities? And so showing up at the local community center with, like I said, a flyer. I've done tabling events in the community just to say, hey, not to recruit, not to do anything, but this is, hey, we want to just bring awareness to suicide prevention within the community and then also within the school community. So I think it's just going a step further beyond what we think about the traditional avenues and mechanisms for dissemination, and then going into those spaces to actually reach the people that need the support based on our findings from the work that we do.
Thank you so much. So speaking of myths and assumptions, Alia, I was going to ask you, what is one of those common assumptions or myths that you've heard about suicide and suicide prevention? Like when you're out in the field, what are those things that you wish people would know is not true?
I mentioned it earlier, and it was also mentioned. I think especially in our communities, because our service area is the city of Rochester, and so our demographics are primarily people of color. And so what we often find is that if there is an attempt or if there is a young person specifically with ideation of suicide, families are truly surprised. They're truly shocked. They don't know where this is coming from. They don't understand it. They have no concept of it. Because again, it is something that traditionally did not happen within our communities. And so that has been one of the biggest myths that we're trying to work on. And when we counsel parents and talk with family members, making them aware of what is happening with our young people and how they can better support. And I think that even for, our team members, that was something that came as a surprise to them. And I know that even for myself, that when we first started, one of our initial calls was around a younger Black man out on the pier at the beach threatening suicide. And so the police were there and the emergency services were there and the divers were there. And when I got to that scene and saw that it was a Black man, I was taken aback because I wasn't educated at that point around what the reality is. So the myth that needs to be broken is that it doesn't happen to everyone when in fact it does.
Yes, thank you. Thank you for sharing that. So Brandon, you've done some work with cities, right? And states and so forth. If I wanted to do work in the city of Rochester, besides, talking with Alia, what's the first step? Like, what are those first steps that you have to kind of take to get suicide prevention up and running with, the mayor, with city officials? How does that all work?
Yeah, I think, we've been privileged enough to do a lot of work with cities and states and help them build plans. So if you got a copy of this, it's literally how we did it. And so as a part of that, I think it honestly starts first with the young people themselves, right? So in working with them, talking to communities, parents, and families about what suicide looks like in Rochester, what it looks like in your local communities, and understanding how young people are talking about it. A lot of the things that we did here is that we engaged with young people. When we brought states out we helped them develop a plan for Black youth suicide specifically. One of the things that they had to do was bring young people with them. They had to be a part of the planning process. We even did one of our whole days the young people led it and they were considered subject matter experts when we were working with the states. And so I think one of the things that we don't do is that we don't talk to the people we're trying to help the change with. So if we as adults figure we got the solutions and we go in and do this, and all you gotta do is put that phone down, delete Instagram, take this stuff off, and go outside, and they're like, that's not going to work for us because my social group is online. But when I game with my friends, that's the only human interaction I get, during the week. And so like learning from them about what is going to impact them, because the interventions, the prevention strategies, the post-vention plans, all that stuff has to be written with them in mind. And it has to be stuff that they're actually going to use, that they're actually going to focus on, that actually speaks to them, resonates with them, and is representative of their experiences. And so sometimes their world, I have a 14-year-old and a 12-year-old. One, y'all pray for me. It's a lot. Two, their how things change with them is rapid, right? Like you look at last year, where AI was last year and where it is now, rapid. New social media sites, new way of conversing, new way of communicating, right? Their language is different than ours. As much as we like to think we have it down, there's a whole other lexicon that they're using that we don't know about. And so I think it really starts there. And once you get that community buy-in and the young people feel like this is something I would support, then you start going to the key folks in leadership. That's when you start going to city council and mayors and things like that. And also key community members, right? Whatever they may look like in other organizations that are already doing it. Because typically there are already folks doing it. It's all fragmented, like we talked about before. Everybody's kind of doing their own thing. And we all know funding is super tight. So if you can kind of get those folks to the table and kind of build it that way, then what you present and what you bring to officials and folks in policy is airtight, and it has the backing of the folks that you're looking to work with. And so I think that's usually not how we do things. Yeah. But I think in good, solid public health, community-based participatory work, that's where it has to start.
Thank you. Thank you for sharing that. All right, Patrice. What role do you believe that foundations should play in supporting community-led suicide prevention initiatives? What do you think foundations should be?
Wow, that's a real good question. Everything. I'm saying everything that we could possibly do is what we should try to do. My brain is wired that I am a AAA, personality, and a planner and a go-getter and a checkboxer, right? So, and I don't take very long to do it, right? Because there's such an urgent need that's there. And so we really don't have a lot of time to try to figure things out. Sometimes we will never figure it out, but we have to move, we have to act. And so for me, it is community events, obviously. I really like peer-to-peer led things. I think that's the key, because when you try to manage or do things top down, you lose people along the way and you never reach the down, right? You got to go from bottom up and you got to involve those young ones. So grassroots efforts always changes things. Why? Because you got peer-to-peer involvement. And so events, mentoring, people who have gone through what these young ones are going through. We had a meeting the other day with Corey Bowman in Cincinnati and Dre Kirkpatrick, which is a former Bengals player. It was the Landon Robinson Foundation, my son, and then our agency, Ethan and Brad Reisenfeld, and then the Ohio State Patrol. We're trying to get together some monthly events in the city of Cincinnati, so that we can talk about these things and help. And one of the things that Dre said in our meeting was that I want to do things and put resources in place for the way I used to think when I was their age. Like, what would have helped me? And let's just start there. And so I told Dre, I said, okay, well, here's what I need you to do, because we don't have a whole lot of time to figure this out. I need you to write down 12, one per month. And then we're going to develop this out. And we're going to develop it out immediately, right? Because Ethan, who is a part of our group, is extremely bright and brilliant in taking thoughts and words and putting them to work on paper. And then I am really good at taking that paper and putting it boots on the ground with it. And that's how we flow, at the, that's how I want to flow, moving forward at the Landon Robinson Foundation. And we've already done some things already, just been in works for 6 to 8 weeks now. It's just amazing, the blessing and what we're doing. But truly, I believe in events, I believe in mentoring, I believe in education, I believe in tapping in the resources that's right here at this table. We need to do everything.
Yeah, thank you so much. I appreciate that. So Donte, I have a question for you as well, obviously. How can researchers do a better job at identifying protective factors rather than focusing on these primary risk factors?
Good question. I was trained in a way that risk and resilience are the opposite sides of the same coin. Where researchers always chose to look at the risk factor. But before I went back to school for my PhD, I learned as a Ryan White medical case manager when I was in St. Louis at the time that when SAMHSA puts out this assessment for HIV positive individual, and it's all negative. So all drug use, homelessness, blah, blah. So I threw it in the trash and said, let's rewrite this with our project coordinator in mind to say, let's write about strengths, right? Like career aspirations, job aspirations, home ownership, children, all these goals, right? We got 100% response rate from 500 clients we had. Everybody filled it out. So some told me that, okay, they respond to things and you learn more about them and they want to engage. And, oh, you do got so-and-so, he might not be taking his meds right now, but he has goals and dreams. And so how do we translate his goals and dreams into getting him to becoming virally suppressed? So I was like, oh, I think there needs to be more of a focus. And so I went back to school to figure out how we can understand protective mechanisms, right? And so even doing research, everything I study is strength-based or looking at assets. I mean, we just turned into R1 looking at strength-based approaches. And I think when you ask about someone's goals, especially now, you realize parents are not asking the questions no more about what you want to be, what strengths do you have, right? Like you go to these meetings and you ask these kids, I'm always asking them, what do you want to do? Or what do you think you want to do, right? Because that changes. And like nobody's asked. It seems like those are the very hard questions, which used to be very easy questions. And so I think asking more strength-based questions, you get more young people into interventions. If you can teach a kid how to build self-esteem or authenticity, you'll probably get more in interventions and say, hey, why don't you join this clinical trial looking at harm reduction for substance use? People are more than just their risk. People have strengths despite the struggle they may be in. And I think trying to find ways to develop intervention and programming around, yes, you might be binging, but we can help you develop, efficacy, practice harm reduction and all these things, I think is a win.
Yeah.
Versus harm reduction, then what? So I think we have to be intentional and seeing people as humans as opposed to just their risk.
Yes, I love that. Thank you so much, guys. So now we're gonna open up the channels of questions, preguntas, if you would like. I know that Chanel, you have some questions online already, so let's go for those first. If you don't mind.
So I have 3.
Okay.
And maybe we can have 2 people you choose who will answer them, please. And maybe I'll just read one. If there's any questions in the room, raise your hand so we can be sure to add you in this queue. Okay, so let's see. What can we do as mental health and substance use treatment groups of services to be better at serving those at risk for suicide? And how can we
engender trust with minoritized communities?
Ooh, Alia, do you mind? Leah and Brandon, if you don't mind.
Okay, I like that question. I think so much of it is about engagement. And again, I come from just being out there doing it, working with people, working with families, and families that are, in need. And so it is also about engaging yourself. I hear a lot in the community about, well, we're engaging with a lot of folks who may have mental illnesses or thoughts around suicide, but that's not what my role is. That's not what my position is. But that's what you're going to face. That's your reality. That's our reality now because it's so prevalent. So again, learning about those who you're going to be engaging with, having the conversations, asking people what they need, what it is that they want. Basics around when someone's sharing something with you, it's what would you like from me? Do you want advice? Do you want me to just listen? Do you want me to just be here? And understanding, I just always go back to responsibility. If you're going to be in the work and this is what you've chosen, then be in the work. That means you have to be all in and willing to continue to learn and grow, educate yourself. And if something is not for you, don't mess over people. It's better for you to pull back from that than to attempt and mess it up. Versus if you're in it and you're genuine, because people can tap into that very quickly as well. But stay on top of things, stay educated, be aware.
Brandon, do you
I
mind?
couldn't have answered it better than how Leah did it, but what I'll add to that is, so I'll piggyback off of that. Authenticity is key. I think also learning, like be yourself and understanding what you don't know. Cultural competency is not a thing. Cultural humility is. Like you're never going to learn anything about somebody else's culture. It's not a test you can pass on that, but it's understanding what their culture means to them, right? And how can you assist with that? So asking those questions that Alia presented as well. And also don't run from it because you're going to encounter it. Get the training on it. Quick shameless plug, Suicide Prevention Resource Center, sprc.org, has a free training on youth safety planning, right? So it's 100% free. You should take it because you paid for it because it's federal, so your tax dollars went to it. But it's free and available for you, and I think there's CEUs attached to it. But take those things and engage with the topic. You don't know what kind of impact you can have with a person. People with lived experience talk all the time about, when they engage with systems, there were so many people that when they brought up suicide, wouldn't address it, wouldn't talk about it, would run from it, would try to give them to somebody else, or they're getting handed it off to all these different folks. But the person they remember was the person that stopped and addressed it and asked what was happening with them. How can they support getting them connected to services and actually really listening to them is really what made the difference. And so I think that's what I would add in addition to what the lead laid on.
Thank you.
Could you give us that website again?
It's sprc.org. It stands for Suicide Prevention Resource Center. It's federally funded TA center that provide everything on their website, all the training, all the courses, all the materials are free.
Great. Next question, or do we have a question in the room? Next question, between 2018 and 2020 through 2024, the suicide rate among Black youth 15 to 29 increased by more than 30%, while the rate among white youth declined slightly. Now Black youth and young adults have a higher rate than their white age peers. What do you think is contributing to this dramatic change? And what are your ideas for future prevention, especially because youth, young adults in general often don't seek clinic-based mental health services?
Danielle, do you mind starting off answering that question for us?
Yes, great question. I think when I think about it in terms of seeing the rates and the increase and trying to pinpoint exactly what is taking place and what's happening, I feel like things have been as they were. And what I mean by that is I think there was always a threat to someone's cultural identity, always a threat to their purpose, always a threat to who they are and continue to be in their existence. And so I don't know, or what I would like to believe is that just a lot of awareness and voice have been given to individuals to speak out about those things. And then we're seeing a reflection of that in the increased rates that we see. For me, in the work that I do, they don't seek out treatment. And my emphasis on the school system and the school setting is the students and the children are already housed there. And so how can we bring this infrastructure within the school setting where they're already located? I remember a time when I was a former school social worker, it was in a rural area. We had the community psychiatrists that would come to the school so that the kids wouldn't have to miss school, so that we wouldn't have to think about transportation of getting them to that. And so wanting to get back to this idea of community schools and serving the kids beyond just specific academics. And I think for me, in terms of intervention and what I would like to see, intervention at the community level, at the school level, but also with this increased emphasis on involving the family, or one key member from the family, getting that insight, getting that contextual understanding of how the kid functions in the home versus within the school setting could really inform a holistic intervention that could save lives. And so for me, that's what I'm gunning for, is to get this involvement with families, to get parents involved, to get a significant individual who the child considers a supportive resource, and what that looks like in terms of having them a part of that intervention. Now, I recognize the entire family unit can't be, or it may be challenging to have them in the full intervention, but if we can identify at least one person that child sees as a supportive figure, somebody that can be involved in the safety planning and in the functioning of the child, would be very important and imperative. And so, to sum this up, because I love this conversation so much, this idea of the school being that community hub and everyone else pouring into that system, because the kids are already there, they're already housed there, and families have a greater likelihood of being connected through that mechanism.
And I would also say to that question, don't forget the siblings. Siblings are extremely important in the family system. And I think, unfortunately, when we think about people that have attempted suicide, or people that have had thoughts about suicide, or people that have unfortunately died by suicide, we forget about the siblings. And I believe that siblings can actually be a point of prevention or even intervention, honestly. And they unfortunately, when I was looking at some research that I've done in the past, reading about suicide deaths, siblings were actually told about the suicide death prior to it occurring. And that with younger kids, so I look at younger kids 5 to 11 years of age, that itself screams to me that siblings could be a point of intervention. Because they didn't speak to their parents, they actually didn't speak to their peers, they told their siblings. And their siblings had no idea what to do. So if we are able to actually educate siblings, then we actually have a force of prevention within the home, and then we're able to get those teachers and counselors ready to rock and roll in the school setting, and maybe we can have a force of prevention within the school setting as well. So now we've got 2 spots where we have intervention opportunity. So I would like to add that as well to that question.
All right. So here's a question that's actually probably, you can answer this, Arielle. Has there been research conducted on whether minority clients have better therapy outcomes when they're matched with clinicians who share similar identities or lived experience?
Yeah, no, that's a great question. So I think it depends, honestly. It really, really, really depends. First and foremost, my first inclination is to say, get that kid in the therapy, period. If they need to see someone, then they need to see someone. And they need to go to CPEP, they need to go to Brighter Days, they need to go see somebody, because I'm not going to wait. I'm not going to wait until the person that looks like me is available if my kid is struggling. So that would be my first recommendation. But on the end of that, once you got them in care, that doesn't mean necessarily you have to stop looking for that person that could be more comforting for that child or for that individual, right? So I have had lots of folks come to me and say, hey, Arielle, can you find me a Black male therapist? No, I can't, but I can find you what we got. Now, mind you, there are Black male therapists out there. I don't want to, say that doesn't exist. They do, but wait lists are long. Let's be honest, wait lists are long. And if your child needs care right now, you need to bring them to Brighter Days, period. So that's where you first need to go and get them the care that they need until you find that Black male therapist that can actually help you. In terms of outcomes, I think there are some indications that yes, that does play a role, because there are some unwritten rules, so to speak, when you are with a therapist that looks like you potentially, but that's not always the case, right? So if I, as a Black female, are hooked up with another Black female, that Black female and I may not be as similar as we think they are, right? And I think what's most important is to acknowledge the fact that, okay, I'm a Black female, and my therapist is actually a Hispanic female. And she's acknowledged, you know what, Arielle, I don't know if I'm gonna know every single thing, and that's why I'm here. I wanna learn. Tell me how I can help you in order to make sure that I am not stepping over boundaries, or I'm not, stepping on toes or insulting you in any way or form, right? So I think it's really about just having that person that knows you and is able to understand where you're from. And that's going to be different for every client, right? So I think what's most important is to, number one, if they need care, get them the care just get them the care, period. And then while they're in that care, that doesn't mean that you have to stop looking for that person. And we, here in Rochester, we have organizations that are dedicated that have Black, Hispanic, you name it, we've got it, right? But that doesn't mean that you're going to be able to get into that clinic immediately. But if you go to Brighter Days, you'll be able to see someone that is trained and actually knows what they're doing, right, with your youth. And we do have CPEP for our adults as well. So yes, remember 988, it's always available. Everybody, always available.
Any
Right.
questions in the room?
And the PIC team is dispatched through 988.
That's
so
right.
please, if you-
Boom.
One final question, apart from awareness, how can we support our community? How can we support younger kids? How is suicide thoughts different or similar between races?
Yeah. Anybody, please. Donte, you want to hit that or?
No.
You want to hit that
No.
one? Yeah.
I think we all have to support. It's interesting. I did a massive evaluation for psychiatry at Texas A&M, and when we were speaking to the rural area outside of College Station, meeting with folks and principals and teachers, a lot of them rejected anything mental health. Right? You have whole school districts in around College Station, that part of Texas, where if you talk about mental health, if we allow you to talk about mental health, then they're going to start thinking they have depression, and they're going to start thinking these things, right? And then same in Ohio, but the difference is the governor and the state has been pushing their own suicide prevention plan, which is probably one of the only states, because their goal is to be the leader in suicide prevention as a state, and shift a little bit with politics slightly, but we're holding on. But making an effort policy wise to support communities and what that looks like, right? I think we have done a good job with mental health awareness, not necessarily suicide prevention, and what that looks like. So educating, and And a lot of us talk as if we're talking to each other, but not realizing who we're talking to in the community, right? The language we use, really meet them where they're at, like linguistically. Even, the words we use, the definitions we use, they might not be on the same page. So how do we all get on the same page? Because if you have people saying suicide's not real, mental health's not real. I mean, I had a colleague tell me who studies a different form of prevention that mental health is not real. And they do research. And so how do we get community buy-in and people to buy in that mental health is real? That suicide prevention is going to keep happening as long as, depression, anxiety, and all these other things, comorbidities are happening, right? How do we get even our institutions to buy in, and not give students 5 sessions and say, go away? So it really takes a village.
Yeah.
It's going to take a village. If we don't build that village immediately, I think the numbers are going to continue to get worse. Especially as unemployment is high, all these structural things are happening. Nothing happens in a vacuum. And I think we got, as far as like research, bigger ideas. The same intervention, just looking at 5 different ways ain't gonna help. We oftentimes sit on grant review panels and you be like, they've been doing this damn project for the last 20 years. And it still hasn't worked, right? So how do we integrate folks who can contribute, working with people we normally don't work with, seeking out organizations who work with adolescents or young people in different ways. Just because they haven't traditionally worked in suicide or worked in mental health doesn't mean they can't. They may have bigger impact. How do we get organizations to say, hey, your organization has been going through a lot of trauma. You ain't built for the community. How can we get you back to a space where, because like with anything else, so one of the clinical trials that I'm a part of, the first thing we did, my mentor, who's at Yale School of Nursing, developed an intervention to learn to treat people in the organization. And so for them to be part of the clinical trial, it's happening in the South. These organizations had to go through this intervention. It teaches people how to treat people for stigma reduction, right? Because the front staff is always the most important person in the organization. It's not the doctor, it's not the social worker, it's the front staff. Because if they don't greet you, they don't treat you, the name call, they're not coming back. And so how do we get organizations that have been falling short that people know, don't go there? And people say that all the time, don't go there, they won't treat you right, the service. And it made me think about, and I don't mean to say this in a mean way, parents online. And no, it's actually, I started reading comments, and my experience when I was transitioning to another institution, I was like, oh, people complain. And I started reading them comments, and then it folded out just the way all these people that complained that way. And I was like, not everybody just complaining just to complain. These things can be real, right? And they do the same thing with organizations. That organization is terrible, but they're the ones in the community. So how do we get them on the ground working? Because it's going to take all of us. It's going to take all of us to do it.
Yeah, I get it.
Or 30% will turn into 60 quickly.
Yeah. So I have one question, one final question. Is that okay?
We're already overtime.
Okay.
Do what you want.
So what's one action you guys would recommend everybody in the audience, everybody online, take today that's going to have an effect for tomorrow?
Don't be afraid to share the knowledge with your families. Because a lot of us, that's where the buck stops. They'll talk about this all day and get home, say nothing. Right? Oh, I can't talk about it with I don't want to argue. I don't want to do all these things. So you rather let someone die potentially or hurt or harm themselves because you're afraid to have a conversation.
Yeah.
What do you think, Patrice? What's one thing?
Educate, continue to educate yourself. Don't be afraid. Education is the key to change. Education is the key to knowledge. And I think education is the key to destigmatize, to take away the fear. You know, a lot of times people are just afraid, and they're afraid because they don't know.
Yeah.
You know, it's not anything you need to be afraid of. It's something you need to do. So
Yeah.
I think education and reading would be what I would say the one thing to take away.
Brandon, what do you got?
I would say for those interacting with young people, I would say be authentic, be actionable, be intentional. Young people know when you're not intention and when your intentions aren't good. They also know if you break a promise with them. If you say you're going to do something and you don't show up in that way for them, they won't forget that, but they will, and they know and they respect and they appreciate the people who do. And trusted adults are incredibly important for our young people. They go through a lot, they experience a lot. And so having someone else that they can trust, that they know is going to back up their word, is important. And I think that goes inside and outside of clinical space.
Leah, what you got?
I agree with what everyone has said, and I would just add that community trauma is very much a reality for all of us. And so if you are aware of people who are in need, be the one to get help for them. Ask them if they'd like to get some assistance. Be aware and knowledgeable about community resources. Be the person that can make a referral. Be the person who can give someone information. We can't hold it all. We can't do it all as individuals, but there are resources that others can take advantage of. So don't be afraid to ask someone if they need help, and then give them some thoughts and ideas on where they could get that help from.
And Danielle, what do you think?
Yes, and with those intentional conversations, I would say listen without judgment. A lot of times people, when they're struggling, they want to be heard and they want to feel seen. And so it's less about how can I solve your problem and more about listening and then encouraging them to get the support that they need.
Thank you so much. All right, one last thing. Let me put this up. So if you guys need anything, please feel free to contact me. Happy to help. But I just want to thank you all so much for coming, and thank you all for being on this panel with me. I am so grateful. So grateful to have wonderful friends in high places. So thank you.
Fine, and in the
Yes,
room.
but please, round of applause. Yes.
Everyone have a great day. And
Yes, thank you. Bye.
Good job.